Do you talk them through this to try to determine if they're doing this for the right reasons? What kinds of questions do you ask?
Well, the consultation's in depth. The first thing that happens is a patient fills out a medical form so we know their past history, because obviously you have to be healthy to have this kind of surgery. On the form, they usually sign what they're considering doing, like if they want a facelift or rhinoplasty, liposuction, or whatever, and I then show them a videotape produced by the American Society of Plastic Surgeons. Once they've done that and they come in and have their consultation, they're pretty educated about what they think they want to do, and then we get in depth.
But is the why of why they're doing it explored?
Absolutely. For example, you would never want to do cosmetic surgery on someone who's just gone through a divorce, just had a loss, a death in the family, had some major emotional crisis, because this is surgery of the psyche. It's emotional. And if you put this type of surgery on top of emotional crisis, you're asking for a lot of trouble. Also, they have to have the right idea of why they want to do it. This is not going to change people's lives, and it's important for them to understand that.
If it doesn't solve problems.
No. If it's part of a process of self-improvement, for example, losing weight, getting connected with your own inner spirit, that type of thing, and you want to look your best and feel your best, it's a great thing. But if you're doing this thinking it's going to change your life, that's not the case.
I was very intrigued by something you said to me while Tony was doing the weather, that women actually deal with these kinds of profound changes better than men do.
Well, the reason for that is women are used to changing. They'll change their hairstyle, they'll change their makeup, they'll change their clothing. Men are not so used to changing, because I said you and I both wear that suit and tie all the time, and all of a sudden if you do something and change somebody dramatically, they might have trouble adjusting to it.
All right, Geoffrey Keyes, thank you very much. Good to have you with us.
Thank you.
Thank you.